Hi, my name is David Edelman, and I'm the Program Director of the General Surgery Program. Thanks for reviewing our slides. Our Department of Surgery starts with our chairman, Dr. Donald Weaver. He's been our chairman for over 15 years. He is one of our oncologic surgeons, and patients from across the state of Michigan get referred to him for their pancreas and liver surgery. I'm the program director. I'm also a Wayne State lifer. I did my undergrad, medical school, and residency here at Wayne State. I've been part of the Department of Surgery for 13 years as faculty, and this is my 6th cycle as program director. My clinical practice evolves around minimally invasive surgery. I do a lot of robotic surgery, bariatric surgery, as well as general surgery. Dr. Sam Terrace is one of our associate program directors. She is also a graduate of Wayne State University School of Medicine. She is the medical director of the ICU of Adult Central Campus. Dr. Michael White is our other associate program director. He is also a graduate of Wayne State University School of Medicine. He is the medical director of the burn surgery program, as well as the fellowship director of our burn surgery fellowship at Detroit Receiving Hospital. This is a map just to show you the proximity of the hospitals. I'm currently located at the DMC Harper University Hospital, which is very close to Detroit Receiving Hospital, as well as very close to Wayne State University School of Medicine. Also on this map is Children's Hospital and the Detroit VA. So the Detroit Medical Center is composed of multiple hospitals: Harper University Hospital, Carmanos Cancer Center, Detroit Receiving Hospital, University Health Center, Children's Hospital, and Sinai Grace Hospital. This is a picture of the front of Harper University Hospital. You can also see that it says Harper Hutzel Hospital. That's because several years ago, a freestanding OBGYN hospital merged with Harper Hospital. So now it's also called Harper Hutzel Hospital. The other thing that you'll notice is that there's a sign here for Carmanos right underneath Harper Hospital, where on paper Carmanos and Harper Hospital are two separate hospitals. In reality, they are a shared space and they use a lot of shared resources. This is a picture of Detroit Receiving Hospital. This is our level 1 trauma center, which is on Adult Central Campus right next to Harper University Hospital. This is a picture of the Children's Hospital. It's a freestanding children's hospital, also on Adult Central Campus. And this is a picture of the front of Sinai Grace Hospital. It's about 10-minute drive from the Adult Central Campus, and we do spend some time rotating there. So the Detroit Medical Center Surgical Residency Program is based out of DMC hospitals. You will rotate through Harper Hospital, Detroit Receiving Hospital, Sinai Grace Hospital, Carmanos Cancer Center, Children's Hospital, as well as the Heart Hospital. However, the residency program also goes to other hospitals. The Detroit VA is literally across the street from the DMC, and there are only DMC surgical residents in the building. We also are the only surgical residents in a community hospital in Livonia called St. Mary's. We go to Ascension St. John, which is in Detroit, for our transplant experience. And some of our fourth-year residents do get to go to Muskegon, northern part of Michigan, for a also community experience. So we are ACG&E approved for 8 categorical residents. You'll see that on the left side of the screen. So 8 residents times 5 years puts us at 40 residents. We are also approved for 12 preliminary PGY1 residents and 2 preliminary PGY2 residents. So our ACG&E complement that we are approved for is 54 residents. However, what you'll see on the right side is the current complement of residents, that we have 6 PGY5s, 7 PGY4s, 8 PGY3s, 8 2s, 16 1s, and 2 in research. And the reason why this looks different than what we're approved for is that we have flexibility in our training. We allow our PGY2 or PGY3 residents to go out into the research lab. We guarantee that they have readmission back into the residency program, and they can go out into the research lab for 1, 2, or 3 years, depending on what their priorities are. So this alters the schedule every year because each resident gets to make a decision independent of the other resident, and that's why the schedule varies slightly each year. This is a very unique component of our residency program here in Detroit. So this is an example of your typical PGY1 rotations. We break the PGY1 rotations into 28-day blocks. We do this purposefully so it's easy to know that we need 1 day off in 7. There are 4 7-day blocks in 28 days, so you get 4 days off on each rotation. The PGY2 through 5 schedules are not distributed like this. But we do send all of the PGY1s to all of the major hospitals and all of the major services during their first year. This is an example of last year's case numbers. You can see the total majors that each resident had, the chief numbers, and the teaching assist numbers. And despite COVID difficulties with access to OR and patient volumes and patients not wanting to return to receive routine care, we are able to maintain the ACGME required case numbers. This slide shows our American Board of Surgery first-time pass rate. The way it's being reported out now is in a 3-year cycle. So our 3-year first-time qualifying exam pass rate is 88%, and our 3-year first-time certifying exam pass rate is 86%. The combined reports of the old days are no longer shown. We have a very structured educational program. The first-year residents have a structured simulation program. This goes on for approximately 3 months, where they have 4 hours of dedicated, protected time in the simulation lab, and there's a topic of the week. All residents have access to the SCORE curriculum. All residents also have access to a basic science lecture series, as well as ultrasound courses that we provide. We are one of 2 testing centers in the state of Michigan that are both FES and FLS certified. We have those simulators always available 24/7 for the residents to use. Our system-wide didactics occur on Wednesday mornings from 7 to 10 a.m. Our M&M session is from 7 to 8 a.m. on Wednesday mornings. Grand Rounds is from 8 to 9 a.m. And from 9 to 10 a.m. is a resident-driven hour. These tend to be SCORE SCORE-driven lectures, where a resident will give a SCORE lecture for the first 20 or 30 minutes, and then we will do a group quiz using a phone app to test and quiz each other. There are also additional app site review sessions on Monday, Tuesday, and Friday afternoons, and each of the rotations have some of their own didactics as well. Our simulation training is very sophisticated. It goes on for several months, like I've already mentioned, where you'll practice open surgical skills, knot tying, wound closure, vascular repair, intestinal anastomosis, as well as endoscopic, laparoscopic, ultrasound, and central line placements. We also offer additional courses. We run an asset course here multiple times a year, and either in your PGY3 or PGY4 year, you'll get to participate in the asset course. We've also started running pig labs. We did the first one last year, and the hope of having 2 more this year. This is to show that we've internally created a surgical app. You can find this on your on any app store. You'll need a username and password to log in, but you can certainly see that. And we use this app in order to page each other, keep a directory of residents, staff, send pages, as well as sometimes do some research audience response on. And this is to show an example of some research that we did a few years ago. This is a picture of a Da Vinci robot. This is here just to say that we have access to Da Vinci robots in all of our hospitals, that Da Vinci training has become ubiquitous within general surgery training, and that you'll have access to robotic cases starting in your intern year all the way through your chief year. This is an example of what some recent graduates have done. Dr. Karji is currently in Tampa doing a critical care fellowship. Dr. Clow is going into primary care practice for surgery in Africa. Sohee Lee is a current MIS fellow here at the DMC. Dr. Malik graduated and is joined the VA practice across the street as a general surgeon. Dr. Nate St. Preux is in private practice. and Dr. David Springstead is our current burn fellow here on campus. There are lots of research opportunities. Again, for those that are dedicated to wanting to spend time in the research lab, will allow you to have those year or years off. But we also have lots of faculty that are interested in trauma, burn, general surgery, education, breast, bioengineering, or cancer research. Our residents are very successful at giving presentations. This is a listing of many local, regional, and national presentations that our residents gave last year. We also won several resident research awards listed here. And this is a photo of us taking our yearly in-service exam next year. Again, thank you for watching our presentation, and we look forward to answering